Before pharmaceutical companies existed, before the word anti-inflammatory was ever written in a medical textbook, people were solving the problem of pain with plants. They were chewing willow bark for headaches, brewing ginger root for swollen joints, pressing comfrey leaves onto bruised limbs. And it worked. Not because they got lucky, because over thousands of years, across dozens of separate medical traditions that never communicated with each other, they were all arriving at the same answers. Modern biochemistry has now caught up. And what researchers have found is that most of these ancient plant remedies were working through the exact same biological pathways that pharmaceutical pain medications target today. In this video, I'm walking you through the complete guide to herbs for pain and inflammation. We're going to cover the science behind why these plants work, which herbs are best for which conditions, how to prepare them properly at home, and the safety information you need to use them responsibly. This is not folklore. This is documented biochemistry. Let's get into it. What inflammation actually is. Before we talk about plants, we need to talk about what we're actually treating. Inflammation is your immune system's first response to injury or infection. Blood vessels dilate. Immune cells flood the area. Signaling molecules called cytokines direct the repair process. That's the redness, the heat, the swelling you feel after a sprain or a cut. That's your body doing exactly what it should. The problem is when inflammation doesn't stop. Chronic low-grade inflammation, the kind that persists for months or years, is now understood to be a contributing factor in arthritis, heart disease, type 2 diabetes, Alzheimer's disease, and several cancers. It stops being a healing response and starts being a damaging one. The two main biochemical pathways driving this process are called the COX pathway and the LOX pathway. COX produces prostaglandins that trigger pain and fever. LOX produces leukotrienes that recruit immune cells and sustain inflammatory signaling. Most pharmaceutical anti-inflammatory drugs, your ibuprofens, your naproxens, block COX enzymes. Many of the herbs we're going to discuss today work through those same pathways. Some of them block both. That is the foundation of why they work. Turmeric. Let's start with the most studied anti-inflammatory plant in the scientific literature. More than 10,000 peer-reviewed studies published on a single compound from a single plant. That plant is turmeric, and the compound is curcumin. Curcumin inhibits NF-κB, which is essentially the master switch for inflammatory gene expression in the body. It blocks COX2 enzymes. It reduces production of TNF-alpha, IL-1, and IL-6, which are the primary inflammatory cytokines driving most chronic inflammatory conditions. The Arthritis Foundation has formally listed turmeric among herbal supplements with meaningful evidence for arthritis pain relief. Clinical meta-analyses have found curcumin produces improvements in pain and function comparable to NSAIDs in arthritis patients. Here's the critical thing most people miss. Curcumin on its own absorbs terribly. We're talking as low as 1% bioavailability without help. The solution has been in Indian cooking for 4,000 years. Black pepper. The piperine in black pepper blocks the enzymes that break down curcumin before it reaches your bloodstream, increasing absorption by up to 2,000%. Fat helps too. Traditional preparations always combine turmeric with ghee or oil. There's a reason golden milk exists. It's engineered for absorption. 1 teaspoon of turmeric, a pinch of black pepper, a little coconut oil or whole milk warmed together. That's golden milk. Drink it daily. Your joints will notice within weeks. Ginger? Ginger is one of those plants that sits in most people's kitchens and is almost entirely underused as medicine. The active compounds in fresh ginger are called gingerols. When ginger is dried or cooked, they convert to shogaols, which are actually more potent anti-inflammatory agents. Both forms block COX and LOX enzymes, making ginger one of the very few herbs that shuts down both major inflammatory pathways simultaneously. A randomized controlled trial published in Arthritis and Rheumatism found ginger extract produced significant reductions in knee pain in osteoarthritis patients with a better safety profile than ibuprofen. Research from the University of Georgia found daily ginger supplementation reduced exercise-induced muscle pain by 25%. For muscle pain specifically, ginger is your primary herb. The simplest preparation is a strong, fresh root tea. Slice 1 to 2 inches of fresh ginger, steep in boiling water for at least 15 minutes covered, and drink 2 to 3 cups daily. For topical use, ginger-infused oil warmed slightly and massaged into painful joints delivers gingerols directly into the tissue. Ginger is one of the safest herbs in this entire guide. Mild digestive discomfort at high doses is essentially the only reported side effect in clinical literature. If you are on blood thinners, use it moderately, as it has mild antiplatelet effects. Willow bark. In 1897, chemists at Bayer synthesized aspirin. The compound they used as their chemical template was salicin, the active component of willow bark. The original had been in the tree the entire time. Written records of willow bark for pain relief go back to ancient Egyptian medical texts, to Hippocrates, to traditional Chinese medicine. 3 completely separate medical traditions, all arriving at the same tree. Salicin converts to salicylic acid in the body and inhibits COX enzymes, directly mirroring aspirin's mechanism. But willow bark also contains flavonoids and polyphenols that provide additional anti-inflammatory activity on top of the salicin pathway. This is believed to be why clinical trials consistently show willow bark produces comparable pain relief to pharmaceutical NSAIDs with fewer gastrointestinal side effects. A systematic review in phytotherapy research confirmed clinically relevant analgesic efficacy for both acute and chronic musculoskeletal pain. For willow bark, preparation matters. The bark is woody material and needs a full decoction. Simmer 1 to 2 teaspoons in 2 cups of water for 15 to 20 minutes. Steep another 20 minutes, then strain. 2 to 3 cups daily for pain management. Do not use willow bark if you have aspirin sensitivity. Do not give it to children under 16. The same Ray's syndrome risk that applies to aspirin applies here. Boswellia and devil's claw. Now we get to 2 herbs that are less familiar but have some of the most impressive clinical evidence in this entire guide. Boswellia serrata, Indian frankincense. Its primary active compound is AKBA, and it works predominantly through the LOX pathway rather than COX. That makes it genuinely different from almost everything else we've discussed, and it makes it an ideal complement to COX-inhibiting herbs like turmeric. A double-blind trial published in Phytomedicine found Boswellia significantly reduced knee pain and improved function in osteoarthritis patients over 8 weeks, with benefits visible within the first week. Boswellia also appears to slow cartilage degradation, not just manage symptoms, which is particularly significant for long-term joint health. The most reliable form is a standardized extract with at least 30% boswellic acids. Look for AKBA on the label. Doses in clinical trials range from 100 to 400 milligrams 3 times daily. Devil's claw is a root from the Kalahari Desert, used for centuries by indigenous Southern African peoples for pain and arthritis. It made it into European herbal medicine, and then into rigorous clinical trials, where a Cochrane systematic review found it among the most evidence-supported herbs specifically for low back pain. The European Medicines Agency has officially recognized devil's claw for joint pain and low back pain relief. That is a regulatory body granting formal status to an herb. That doesn't happen often. Devil's claw requires hot water extraction. Simmer the root, don't just steep it. For standardized extracts, look for 2% harpagicide content. Avoid it if you have peptic ulcers or are pregnant. 5 more herbs worth knowing. 5 more herbs that belong in this conversation. Rosemary. Rosmarinic acid, one of its primary compounds, inhibits COX enzymes and is bioavailable through both culinary use and tea. A clinical study found rosemary extract reduced pain and disability in knee osteoarthritis patients at 6 weeks. It's already in most kitchens. Start using it medicinally. Cat's claw. Amazon rainforest vine with alkaloids that inhibit TNF-alpha production by up to 65% in clinical studies. That level of cytokine suppression is clinically significant, particularly for rheumatoid arthritis, where TNF-alpha is a primary driver of joint destruction. Cloves. Eugenol is one of the most potent natural COX inhibitors identified in any plant compound. Clove tea or clove-infused oil for topical joint pain. Simple and effective. Arnica. Topical use only. The sesquiterpene lactones in arnica inhibit NF-κB in tissue. A systematic review found consistent evidence for reduction in bruising, muscle soreness, and joint pain compared to placebo. Pharmaceutical-grade topical arnica formulations are sold in European pharmacies. Make your own infused oil with dried arnica flowers and a carrier oil. Comfrey. Also topical only. Allantoin promotes tissue regeneration. Rosmarinic acid reduces local inflammation. A randomized trial found topical comfrey root extract outperformed a pharmaceutical diclofenac gel for ankle sprains. The research on this one is genuinely impressive. External use only. Oh, the cortisol connection. Here's something most pain guides never address. Chronic pain and chronic stress are biochemically linked, and if you treat one without addressing the other, you're working against yourself. Chronic elevated cortisol from sustained stress creates a paradox in the body. It suppresses immune function in ways that simultaneously increase chronic low-grade inflammation. Stress drives inflammation. Inflammation drives pain. Pain drives stress. It becomes a self-reinforcing cycle. Adaptogenic herbs interrupt that cycle by regulating the HPA axis, which controls cortisol output. Ashwagandha is the most studied adaptogen for this purpose. Its withanolides inhibit NF-κB directly while simultaneously reducing cortisol output. A double-blind trial published in the Indian Journal of Medical Research found significant improvements in pain and function in knee osteoarthritis patients after 8 weeks on standardized ashwagandha extract. 300 to 600 milligrams of KSM-66 or sensoril extract daily. Rhodiola rosea doesn't work as a direct analgesic, but has documented effects on reducing inflammatory biomarkers and improving pain tolerance in fibromyalgia and chronic fatigue patients. If your pain picture involves significant fatigue and stress, rhodiola belongs in your protocol alongside the anti-inflammatory herbs. Building your protocol. Let's match herbs to conditions so you leave this video knowing exactly what to reach for. For osteoarthritis and joint pain, the most evidence-backed combination is turmeric with black pepper plus boswellia. COX and LOX pathways covered simultaneously. Add devil's claw if lower back is involved. Apply cayenne or comfrey oil topically to the affected joint on top of the internal protocol. That combination addresses the condition from 3 angles at once. For acute muscle pain or injury, lead with ginger in the first 24 hours. Tea or tincture taken within the first day of injury consistently reduces pain and inflammatory marker levels. Topical arnica addresses the bruising and swelling. Willow bark handles the acute pain without the gastrointestinal load of NSAIDs. For chronic inflammatory conditions, including rheumatoid arthritis and fibromyalgia, you need sustained daily support, not acute intervention. Turmeric, ginger, and ashwagandha. Daily, consistently, over months. Cat's claw adds cytokine suppression relevant to autoimmune inflammatory drivers. Evaluate honestly at the 3-month mark. Chronic conditions need chronic treatment. For neuropathic pain, topical capsaicin is your primary tool. The substance P depletion mechanism is exactly what pharmaceutical capsaicin patches work on. Make your own cayenne-infused oil and apply it regularly. It will burn initially. That's the substance P releasing. Within a week to 2 of consistent use, pain signaling in the treated area diminishes significantly. Safety and interactions. Herbal medicine is real medicine. Real medicine has real interactions. I want you to use these herbs confidently, and that means knowing where the caution lines are. The most important interaction category across this entire guide is blood thinners. Turmeric, ginger, willow bark, and devil's claw all have antiplatelet or anticoagulant effects. If you're on warfarin, aspirin therapy, or any blood-thinning medication, talk to your doctor before adding these herbs at therapeutic doses. Combining multiple agents that slow clotting is a real risk, not a theoretical one. Surgery. Discontinue anti-inflammatory herbs at least 2 weeks before any scheduled procedure. Tell your surgeon and anesthesiologist what you've been taking. This is not optional. Pregnancy. Willow bark and devil's claw are specifically contraindicated. Most therapeutic herbal doses have not been studied in pregnancy. Culinary use of ginger and turmeric is generally considered safe, but therapeutic supplementation is a different category. Get qualified guidance. Autoimmune medications. Cat's claw and other immune-modulating herbs may interact with immunosuppressants. If you're managing an autoimmune condition with pharmaceutical immunosuppressants, consult your rheumatologist before adding immune-active herbs. Liver and kidney impairment changes how herbs are metabolized and cleared. Reduced function means adjusted doses and closer monitoring. Work with a qualified practitioner in those cases. Some final thoughts. The herbs in this guide represent thousands of years of human observation about plants and pain, refined by modern science into something we can use with confidence and precision. They are not a replacement for medical care when that care is genuinely needed. But as part of a thoughtful approach to managing pain and inflammation, they offer real options that most conventional medicine conversations never even mention. Start with 1 or 2 herbs that match your primary complaint. Use them consistently. Give them time. The body responds to these compounds at a biochemical level that has nothing to do with belief and everything to do with chemistry. The complete written guide with preparation instructions, dosages, and all the research citations is linked in the description below. Read it alongside this video. If this helped you, share it with someone who's been reaching for ibuprofen every day and wondering if there's another way. There is. I'll see you in the next one.